Hello, I'm here with Dr. Melhem Solh, an expert in diffuse large B-cell lymphoma, or DLBCL. In this video, we'll discuss some practical considerations related to frequently asked questions regarding Zynlonta. Dr. Solh, the first question has to do with patient selection. For whom should Zynlonta be considered?
To address patient types, let's talk about the participants in LOTUS-2, which was a Zynlonta pivotal trial. As shown here, LOTUS-2 included a broad range of heavily pretreated patients with difficult-to-treat disease, such as patients with intensive salvage therapy failure, refractory disease, 2 to 7 lines of prior therapies, diffuse large B-cell lymphoma arising from low-grade lymphoma, and high-grade B-cell lymphomas. The overall response rate was 48.3%, and half of those patients, or 24.1% of all patients, they achieved a complete response. When we did an exploratory analysis to look at responses in select patient subgroups, such as patients with diffuse large B-cell lymphoma arising from low-grade lymphoma, or patients with high-grade B-cell lymphomas, patients with prior stem cell transplant, prior CAR T-cell therapy, and any patients with refractory disease. Overall, responses were observed regardless of age, disease type, level of refractoriness, number of prior lines of therapy, or treatment history. And remember, these responses were observed with a single agent infusion once every 3 weeks.
Thanks. That should be very helpful to prescribing physicians. Okay, another common question is, can Zynlonta be used after another CD19-directed therapy?
That's actually a great question, and the answer to your question is yes. But I'd like to note that there are no specific clinical recommendations for transitioning between CD19-targeted therapies. In the LOTUS-2 trial, 9% of patients had received CD19-directed CAR T-cell therapy prior to treatment with Zynlonta. Those participants were required to have confirmed CD19 expression before they received their Zynlonta therapy, although CD19 testing is not required for Zynlonta use. The response rate for those patients was 46.2%, including 2 patients with a complete response.
That's good to know. A follow-up question is, has Zynlonta been used before another CD19-directed therapy?
Well, in the LOTUS-2 study, 15 patients went on to receive subsequent CAR T-cell therapy after disease progression. In these cases, Zynlonta was not used as a bridge. The safety and efficacy outcomes for those patients have not been confirmed in a randomized clinical trial. Just note that the impact of diffuse large B-cell lymphoma treatment on CD19 expression levels has not been fully elucidated.
The next 2 questions are a little more patient-focused. First, how should healthcare providers counsel patients? Are there specific topics that should be discussed?
I appreciate this question. It's important to set expectations with patients and their caregivers before treatment is initiated. The Zynlonta full prescribing information includes specific counseling points that you'll see them projected here. As you can see, physicians are encouraged to counsel patients about effusion and edema, about myelosuppression, infections, cutaneous reactions, embryo-fetal toxicity, and lactation. Patients should also be advised to read the FDA-approved patient labeling or patient information, which provides more details about what Zynlonta is and what patients should tell their doctor before receiving Zynlonta and what to expect from therapy.
Thank you, doctor. And if I may take a moment to tell our viewers about the robust patient support program available to eligible patients who are prescribed Zynlonta. I understand it offers personalized assistance from ADC Therapeutics. Dedicated case managers can provide the support needed to help patients get started and stay on Zynlonta therapy. Patients and their caregivers can ask questions, discuss concerns, and get some guidance in addition to financial support. Prescribing physicians who want to learn more about the program associated with Zynlonta can call Advancing Patient Support at the number on the screen or visit advancingpatientsupport.com. Dr. Solh, thanks so much for sharing your time and expertise. We hope you found this discussion informative. To see more of our discussion, please watch the other videos available in this series. For additional information, you can visit zynlontahcp.com or contact your ADC Therapeutics sales representative. Now, please take a moment to view the important safety information for Zynlonta.